Good evening. Namaste to all our viewers. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, and medical writer. So, on my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with a topic thrice every week and related to Ayurveda, mental health, psychotherapy, and other aspects of these subjects. So in the last session we had discussed about what is depression, what are the causes of depression, like clinical depression, and what are the symptoms of depression and all the other things. If you have missed the session, you can refer to that session. The links will be provided in the description. So today is a continuation session on that. So today we are discussing the effects of depression on body and mind. So, every mental health disorder will have some effects on mind and body. So, what are those? And then we are going to discuss how do we manage depression. See, depression management in itself is a vast subject. So, I will discuss a few aspects of management today and maybe continue with a few more aspects in the next session. We are going to discuss, and we are also going to discuss what we do as Ayurvedic psychotherapists, or at least what I do. What is the Ayurvedic psychiatry or Ayurvedic psychotherapy, the Sattva Chikitsa for depression. We're going to discuss all of these in this session. So, without wasting time, let's get started. So, depression, just for the recap, for who have missed, what is depression in the last session, I will just, brief a little bit about depression. See, depression is a mental health disorder. We are talking about clinical depression here. Depression, always take it as clinical depression. And depression is a mental health disorder characterized by persistent feelings of sadness, loss of interest in activities, and changes in appetite or sleep patterns, constant fatigue, and difficulty concentrating. There may be persistent irritability. That means हमेशा क्लिनिकल डिप्रेशन उसको कहते हैं जिसमें परसिस्टेंटली आदमी या औरत सैड रहते हैं और उनको किसी भी एक्टिविटी में चाहत नहीं रहती. ईदर दे स्लीप टू मच और दे हैव डिस्टर्ब्ड स्लीप. Either there is increase in appetite or there is no appetite at all. They don't eat at all. There is a decrease in appetite. So there'll be changes in appetite, sleep patterns. They will always be irritable because of the constant sadness and lack of motivation and interest. And they will always have difficulty in concentrating in productive work. So what happens is all these combinedly will affect their daily functioning. So, this significantly impacts their daily life and can lead to emotional and physical stress. These symptoms, as I said, are not only limited to the mind, it might also extend to the body. So they may experience physical symptoms, and in most of the cases, they will experience physical symptoms. So after, this is the definition. If you want to know more about it and what is normal sadness versus depression, everything is explained clearly in my previous session. So please refer to that session if in case you have missed it. So now, depression can have significant effects on both mind and body. So what effects it has on mind and what effects it has on body? That means constantly being depressed will come with lot of effects on mind and body. So first, effects on the mind. What will be the effects on the mind? So persistent sadness. Individuals with depression often experience prolonged feelings of sadness, hopelessness and emptiness. This is not normal sadness when we experience if something goes wrong at the work or in our personal lives, etc. This is different from what we experience generally. This persistent sadness may persist more than weeks without any specific trigger. There might not be any trigger or any reason for sadness. And these individuals will have cognitive difficulties. Cognition means difficulty in thinking, difficulty in concentrating, difficulty in memorizing, all these difficulties. This, what I am talking about, it may vary from individuals to individual. It is not the same for every individual, you know and all the symptoms will not make a person might not experience all the symptoms. So few people will have few symptoms and few people will not have few symptoms, they will have another set of symptoms. So this is customized, this is not for all. But what I'm talking about is in general they will have all these things. So, depression can lead to problems with concentration, memory, decision making. They cannot make decisions, effectively, and overall cognitive function. Cognition means thinking. In the thinking, concentrating, memorizing, whatever it may be, all these cognitive functions. So, and negative thought patterns. People with clinical depression, the depressed individuals may have a tendency to engage in negative self talk. You must have observed some people talking to themselves. Now, it may not be always depression, but people with depression also have negative self talk, and they always have pessimistic outlooks towards life. See, everything is gonna go bad. I am worthless. I am hopeless. Everything in my life will go bad. All these kinds of negative thoughts, they experience all these kinds of negative thoughts. So, depressed individuals often experience persistent negative thoughts. Self doubt, they always have self doubt. I am not worthy. They might have different people, will have different feelings. So, they will have feelings of hopelessness as well. So this negative thinking can worsen the condition and hinder their ability to see positive aspects in life. They do not see what all positive things are happening in their life, or they do not see what positive changes can be brought in their life. So, and they always have lack of interest and pleasure. See, there is a condition called anhedonia. So anhedonia is a common symptom of depression. This means they will not have interest in anything. So it leads to a reduced ability to experience pleasure or interest in activities that were once enjoyable. See, for some people, for some hobbies, they might feel interested. Some people feel good when they dance, some people feel good when they paint, some people feel good when they do gardening, some people feel good when they exercise or do yoga and meditation. Different people have different hobbies which creates interest and pleasure in them. So in these people, they do not seek pleasure or interest in any of the activities or hobbies, even though once they liked it in their lifetime. And yeah loss of interest in everything, the lack of interest. And see, what happens is ultimately the quality of life is diminished. And impact also happens is social withdrawal. Depression can cause people to isolate themselves. They do not talk to people, they do not go to social gatherings, they always avoid work related social gatherings as well. They might avoid presentations, they might avoid public appearances or social interactions, and all these you know further exacerbates, further increases the feeling of loneliness. All this, the social withdrawal increases, actually increases the depression, and they always feel that they are tired, because they have persistent feeling of fatigue is tired, and low energy levels. They do not have energy for doing anything. And rumination is a phenomenon wherein depressed individuals may engage in repetitive and intrusive thoughts. See, repetitive negative thoughts, or they will always think that I am worthless, I am hopeless, this did not go well, that did not go well, bad thing may happen, nothing good is going to happen about my life, all these things. And this depression, as I have spoken in my earlier session as well, this might happen with various causes or life events, because of various causes and life events. So, and at any stage of life, depression can occur in any stage of life, even though it is mostly observed in teenagers and young adults. It is, mostly, brought into light by teenagers and young adults, but it can happen in any stage of life. And then the emotional changes, person with depression becomes emotionally numb, and he's always irritable. And some people may also experience, excessive guilt about something, excessive, guilt. And if it is a professional cause of worthlessness, that I am worthy of nothing, all these feelings you will have if you have depression. See, these are the effects. And finally, the suicidal thoughts. This is not very common, but at a stage, a person might experience suicidal thoughts. In severe cases, depression may lead to suicidal ideation, with individuals contemplating self harm or suicide. They're always thinking about how to harm myself. How should I die? I'm worthy of nothing, so I should die. So they're always thinking of self harm and suicide. So this, if this, is, if you like experience any of the symptoms, because this is very critical, suicidal thoughts are very critical. Before that, if you approach, if you get a proper therapy or proper treatment and care, these things can be avoided. So early intervention, can prevent critical warnings or critical signs. So seek immediate professional help if any of these happens. And effects on the body. See, next is the effects on the body. So what all these which I spoke about is the effects on the mind. Now what I'm speaking of is effects on the body. So what are the major effect is sleep disturbances. See, this depression can disrupt sleep patterns. Either they excessively sleep, they're always on bed, or they have insomnia is sleep disturbance. They can't sleep continuously for 6 to 7 hours. They have disturbed sleep. They wake up and they are not able to get back to sleep. So then, as I said, appetite changes. See, some individuals may experience significant changes in appetite, leading to weight loss or weight gain. See, weight loss happens when the person is not at all, interested in eating. His appetite is completely lost. Weight gain happens is due to depression, people start binge eating. That means they continuously go on eating. to get temporary relief from their sadness. So both might happen, either weight loss or weight gain. And people may also experience, this is unusual, but physical aches and pains. Depression, if it becomes chronic, it may lead to physical symptoms like headache, muscle ache, and stomach problems as well. They will have gut issues. See, and what happens is, gradually their immune system gets weakened. So long term depression may weaken the immune system, making the individual more susceptible to illnesses and increased risk of chronic diseases. There is a link between depression and an increased risk of chronic conditions is any physical symptoms, such as people might develop heart disease, diabetes, and various chronic illnesses due to constant or chronic depression. See, it also has an impact on nervous system. Depression can affect the functioning of the nervous system and contribute to, because of depression they may develop stress as well. So depression may lead to chronic stress responses. It may be vice versa also. Chronic stress also in some cases might lead to depression. So increased stress hormones, because of the stress, depression triggers the release of stress hormones like cortisol. See, cortisol is a stress hormone. So when cortisol is increased, then it is constantly elevated in depressed individuals if they have, if that is associated with stress, and which can further lead to health issues, again body symptoms, and they may also develop into cardiovascular problems, that is heart problems. And then see, it is essential for individuals experiencing symptoms and depression to seek professional help and support. See, I've again and again and again repeated in my videos that as you approach a doctor for your fever, for your abdominal pain, for your headache, for your COVID, etc., 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 in the same way, you can approach a psychotherapist or a psychiatrist for a mental health issue. Don't keep it as a taboo. See, because you know what, a psychotherapist or a psychiatrist is a you know third party expert. That means these we psychotherapists and psychiatrists will not judge you for anything. Our motto is to solve your problem without judging and giving unbiased solution for your treatment. Yeah, it might take weeks of therapy and counseling to get out of it, because it is not a one day thing. But it will as as early you approach, as easily you will be fine. So you will there will be gradual improvement. So it is important to seek a professional help. And if you also observe in your family members, all some of the symptoms can also be observed by the family and closed ones, uh, uh, trusted people. So what happens is, and in depression, we have a cycle. See, depression can follow a cycle, which has various stages, from the triggering events to managing and overcoming the condition. So I'll give you a detailed explanation of the depression cycle, how it starts, how it continues, and how do we manage, how can it be managed with a simple case study. So, triggering events, usually how depression begins. See, the cycle often begins with triggering events such as major life change, loss of a loved one, and chronic stress, whatever the condition may be. There may be a major life change, there may be a loss of loved one, or you may lose your loss of job by downsizing or whatever, and chronic stress, and you have experienced any significant trauma. So all these becomes the triggering events. So these events can lead to emotional distress and disrupt the individual's sense of well-being. So what happens is, these trigger may create a distress and disrupt the individual's sense of well-being. So, example, what may be the triggering event? We will consider, Vanilla as our client here. Vanilla is a 30-year-old woman, experiences the sudden loss of her job. She has lost her job due to downsizing. This was unexpected. So, this unexpected event triggers feelings of worthlessness. I lost my job because I am not worthy of it. Worthlessness and hopelessness, making her vulnerable to depression. So what this does is, this makes her vulnerable to depression. So this leads, this trigger of losing her job because of the downsizing, and her thoughts of I am worthless, leads her to depression. So what happens is, once there is triggering event, there are onset of depressive symptoms. So following the triggering events, the individual, here vanilla, may start experiencing depressive symptoms such as persistent sadness, fatigue, loss of interest, changes in appetite, and sleep disturbances. What happens is, these symptoms may intensify over a period of time. Intensify is, it is symptoms can increase over a period of time, affecting various aspects of vanilla's life. So here onset, as days passes after losing her job, Vanilla here finds herself struggling to get out of bed and feeling exhausted and demotivated. And Vanilla loses interest in activities she once enjoyed, such as painting and spending time with friends. What happens is, once it is the onset of depressive symptoms, then comes the negative thought patterns. Depression often involves negative thought patterns such as self criticism, pessimism, and feelings of hopelessness. So, what happens is, Vanilla starts blaming herself for the job loss, believing that she is a failure and will never be able to find another job. So what happens is, she starts blaming herself in her mind. Okay, I am worthless, I am a failure, I'll not be able to find another job. So she feels overwhelmed by negative thoughts. See, this leads to increased sadness and self doubt. This increases, sadness and self doubt, and the symptoms also get increased. The loss of interest and not getting out of the bed also increases. What happens once, there are negative thought patterns and there are symptoms? What happens is, it impacts the daily functioning. So depression can significantly impact an individual's ability to function in their daily life, affecting work, relationships, and self-care. They will become socially withdrawn, experience difficulty concentrating, and have trouble fulfilling responsibilities. So here Vanilla's depression hinders her job search. This is impacting her daily life now. What happens is, she feels that she is worthless and she is a failure, so she will not opt for job searching at all. So, and she feels unmotivated to apply for new positions. She has no motivation for applying for a job for new positions. Then what happens? Finally, gradually it leads to, she avoids socializing with friends. Self esteem comes down. So with a low self esteem. All what happens is this impacts in daily life, so her productive life, work life is hampered. Next, what happens is, next vanilla what she does is, next she approaches a mental health, support, a psychotherapist or a psychiatrist for the support and treatment. At this stage, we have to, you have to approach a mental health professional. See here, Vanilla eventually opens up to her close friend about her feelings and struggles. Her friend encourages her to seek professional help. So Vanilla starts attending therapy sessions where she learns coping skills and receives emotional support. What happens is, once you start psychotherapy, there'll be group therapy sessions as well, where the same condition, the people with depression or whatever mental health disorder you might experience, the same set of people will be there. They can share their thoughts, their experiences, how are they coping, the strategies. You can, everything can be managed with groups. So that gives an emotional support that you are not alone. And with the psychotherapist, you will learn coping strategies. You will, there are many things, many treatment strategies which is planned and advocated, structured. There is a structured approach of doing it, and gradually coping and treatment management. So as you know, through therapy, Vanilla gains insights into her negative thought patterns and learns to reframe them. There are constructive restructuring in cognitive behavioral therapy. There are different types of therapies, different types of cognitive exercises, practiced, so that, the negative thought patterns, and they can be reframed to positive patterns. And thought reconstruction is done, journaling is advised, everything she does, and she practices mindfulness techniques to manage her emotions and find support in her therapy group. So there is a gradual improvement over time. With consistent effort and support, the individual may experience a gradual improvement in their symptoms. So positive lifestyle changes. There are lifestyle changes, changes in the diet and nutrition, changes in the exercise, with the regular exercise and social interactions, all can contribute to this, process. So, what happens is, Vanilla continues therapy and implements self help strategies. There are some self help strategies. She starts to regain a sense of purpose and hope. Once you start to regain a sense of purpose and hope, she gradually builds her social connections and begins exploring new job opportunities. So next comes the maintenance and relapse prevention. Once Vanilla recognizes the importance of maintaining her health, even after finding a new job, she continues attending therapy on a less frequent basis now, and establishes a support system to prevent potential relapses. So this is the complete journey. See, remember, each person's, journey through depression is unique, and the cycle may vary in intensity. See, the depression intensity of the depression is different for different individuals. There are many types of depression as well. We can talk about the types in some other session, but there are different types of depression as well. And depression varies in intensity and duration for from person to person. But early recognition of symptoms and seeking support and professional help play a vital role in managing depression effectively. So all these, next what we do in, ayurveda, that what is done in Ayurvedic psychotherapy, there is a holistic, approach. that considers individuals' physical, mental, and emotional well-being. When it comes to Ayurveda or Ayurvedic psychotherapy or Sattva Vajaya Chikitsa or Ayurvedic psychiatry, we consider a person as a whole. So there is a physical, mental, and emotional approach. So this approach is called holistic approach. So Ayurveda views depression as imbalance in the doshas and trigunas. So doshas are vata, pitta, and kapha. If there is imbalance in the vata, pitta, or kapha and in the mind, and the trigunas we call sattva, rajas, and tamas, and the treatment focuses on restoring this balance. So here, what we do is identifying the dosha imbalance. Whatever the Ayurvedic psychotherapist or a psychiatrist assesses the individual's dosha constitution here and identifies any imbalances that may contribute to depression. And then what, promoting sattva, the Ayurvedic psychotherapy is called sattva vajaya chikitsa. Sattva vajaya chikitsa is, sattva is one of the trigunas, that is qualities in Ayurveda representing purity, balance, and harmony. That is positivity. Sattva, positivity, and purity. So sattva avajaya chikitsa focuses on promoting sattvic qualities in individuals to enhance mental clarity. What is the aim of this? To enhance mental clarity, emotional stability, and a positive outlook. So, what we do here is we also do counseling and emotional support. See, Ayurvedic psychotherapists provide counseling and emotional support to individuals dealing with depression. This support can help individuals cope with their emotions and develop a positive mindset. And then our Ayurvedic therapy. See, certain Ayurvedic therapies, some one therapy called Shirodhara is, I think some of you might have heard. Shira means head. Dhara means pouring of warm oil on the forehead. See, pouring of different types of warm oil on the forehead. This is the treatment technique. It involves, this has to be done in a setup. So, and this treatment for some types of depression. And abhyanga is therapeutic massage. And panchakarma is purificatory or detoxification procedures. This is customizable. This is different for different patients, different patient with different symptoms, depression symptoms. So this might, according to their prakriti and roga. So this might or may also be recommended to early to decrease stress and promote relaxation. So, and herbal remedies, herbo mineral remedies, medications are also advised, to decrease, to improve mood and stability and emotional regulation and decrease stress. And as I said, panchakarma as well. Pancha is five, karma means therapies, the five therapies which may be advised according to your condition. Like it could be like emesis, purgation, nasya, nasal administration, all these things. Basti, enema, and rakta mokshana is bloodletting. All these may be involved. Procedures may be, if required, they may be administered. And of course, meditation and yoga and mindfulness practices. See, meditation, yoga, and pranayama, all these changes your lifestyle and helps in improving mood and calm the mind, improve self awareness. It reduces stress and anxiety. So everything, daily physical exercise is also important for depression. Then comes the diet and nutrition. So Ayurvedic psychiatry or psychotherapy also emphasizes on the importance of balanced diet to support mental health. And lifestyle, there will be lifestyle recommendation according to your prakriti and according to the doshas impaired and according to the symptoms. um, or you will have some lifestyle recommendation, and counseling and emotional support will be there. And sattvic lifestyle, what does sattvic lifestyle do is it promotes inner peace, harmony and contentment. So engaging in uplifting hobbies and activities, spending time in nature, practicing gratitude, all everything. And apart from this, there will be individualized treatment. This is what is advised, is done in Ayurveda. Apart from this, I practice psychotherapy, so CBT, different types of talk therapy, cognitive behavioral therapy, journaling, cognitive exercises, everything is done to that about the therapy and the types of depression. I'm going to talk in next session or some other session. So there's some self-help strategies, when you experience like symptoms, when you see people experiencing symptoms, you have to definitely approach a mental health support. But these will help you uplift your mood, calm your mind, relax. So regular exercise, maintaining a healthy diet, sleeping for sleep schedule is very much important. Because sleep can improve overall well-being. Good sleep, sound sleep can improve overall well-being. Mindfulness and meditation, and mainly avoiding alcohol and drugs. See, alcohol and drugs can increase depression. Substance use can worsen depression symptoms, so it is better to avoid. And setting goals is also important. A self-help strategy: break down tasks into smaller, into achievable goals. Avoid feeling overwhelmed, and then you will gain a sense of accomplishment. If you have accomplished something, reward yourself. Have have some self love and gratitude. And challenging negative thoughts. So I will teach you some of the cognitive behavioral techniques, to challenge and reframe negative thought patterns that contribute to depression. Next time I'll teach you. Next is social support. Whenever you feel depressed, you have to stay connected with your friends and family, the trusted ones, your support system. Share everything with them, seek support from them whenever needed. So social interaction can be very much beneficial. And next thing is, important thing is, engaging in hobby, whatever hobby you feel good. Either it is dance, either it is gardening, either it is swimming, whatever you feel good. Engage in some activities, engage in some hobby, reading, writing, whatever is you like, whatever hobby you like, you can engage in them, because they can serve as a positive distraction from the negative emotions and negative distraction. These, building a hobby can be a positive distraction. And the important thing is, as I said, journaling, writing down your thoughts and feelings. And is the thought really valid, or it is just in my mind? Am I really worthless, or it is just in my mind? See, losing a job or does not mean that a person is worthless. It is just in his or her mind. So writing down and self expression, writing down, what happens is it will bring the clutter from your mind to the paper. So journaling is very important. Then the sources, seeking sunlight and spending some time in nature is also very important to enhance your mood, for the mood improvement. And avoid isolation. See, it is very important when you feel depressed or sad, don't get isolated. Go talk to your family, go talk to your friends, and try to resist that urge and spend time with supportive people who can understand you and who can encourage you. the trust group, whatever the trust group you have, your friends, your families. And the most important thing is educate yourself about the condition, learn about depression or whatever mental health issue you're facing or symptom you're facing. Learn about depression and its symptoms, as understanding the condition might help you cope with the coping it coping with its challenges. Understanding the condition, what may happen, educating yourself is most important. So it's important to make a note that these self-help strategies can be beneficial, but they will not be sufficient to treat chronic depression or persistent depression. So I will urge you, if you are suffering with any of the symptoms or if your loved ones are suffering with any of the symptoms, please do approach, seek a support from mental health professional. So and this is it for the session. I think I have elaborated on few of the topics, and the remaining topics will be discussed in the next session. And let me know what you think of the session in the comment section, so that and if you have any other topics which you want me to discuss on regarding Ayurveda or psychotherapy or Ayurvedic psychotherapy or mental health, you can just share it in the comment section. I will come up with it in my future sessions. So thank you for staying tuned, and namaste.